Good afternoon. This is a public hearing for HSB 327, a bill on act of appropriating the federal monies made available from the federal block grants and other non-state sources, allocating portions of federal block grants and providing procedures and federal monies of federal block grants and more or less than anticipated. So we will start the subcommittee meeting with speakers, of course. Is there anybody on the panel that would like to say anything before that? All right. So we'll start with our first speaker. That will be Andrea Mizak. Is that correct? And you're with IJAG. You have 2 minutes.
Thank you. My name is Andrea Mishak with Iowa Jobs for America's Graduates. Thank you for allowing me to take the time to emphasize how important this bill is to IJAG, and particularly the enabling us to apply for TANF funds through HHS. The inclusion of the flexible language regarding the use of TANF federal block grant dollars is critical. It would allow IJAG to braid state, federal, and private funds to increase our capacity to reach more students across Iowa. The TANF program has the financial capacity to support organizations like IJAG that align directly with their strategic priorities: child welfare prevention, economic mobility, and person-centered programming. Currently, 77 school districts across the state meet criteria like chronic absenteeism, high percentages of free and reduced lunch, and low post-secondary and career readiness. IJAG is uniquely positioned to support these districts by equipping students with the tools and directions they need to pursue long-term success through our 25 years of service that is evidence-based, and we serve 10,000 students just this year alone. Within the JAG National Network, there is $26 million of TANF funds used in other JAG program states like Nebraska, Indiana, Kansas, and Wisconsin. Your support for this language change is essential and truly appreciated.
Thank you, Andrea. Our second speaker will be Cynthia Steidel Bishop with Irely Ball Community Mental Health Center.
Thank you. Again, my name is Cynthia Steidel Bishop. I'm the president of Irely Ball Community Mental Health Services in Central Iowa. Thank you for allowing me to speak about the federal block grant from the perspective of a provider and why the block grant is critical to our operations. The reason the federal block grant chose to allocate the block grant specifically to CMHCs is because the CMHCs are a safety net organization. There are many safety net organizations that serve the vulnerable and underserved, but what makes the CMHCs different is that we serve the most chronic, complex, and difficult to treat clients. We receive referrals from other safety net providers and private providers when the client requires a higher skilled psychiatrist that CMHCs are required to have on staff, more highly skilled and trained therapists, and we provide the full continuum of services that meet all the needs required for the most chronically mentally ill clients. We need the additional dollars to support the treatment of the most difficult and vulnerable clients. In the last few years, the state has allowed the CMHCs to expand the use of block grant dollars, and a high percentage of our total allocations go directly to serve clients. Many of our clients don't have the ability to pay for their high deductibles, their co-pays, or they lose their insurance. The block grant covers these costs. If we lose the block grant, it will be devastating for our clients and for the CMHCs if we are expected to eat the costs. We understand the mental health system in Iowa is changing, and we have to pivot to adjust to those changes. Mental health services are changing from a region management system to an administrative service organization oversight. Disability services are changing to disability access point management, and the start of certified community behavioral health clinics, or CCBHCs, are all set to begin July 1st. These are massive changes to the mental health service providers and the CMHCs. Please allow one more year of block grant allocations to the CMHCs as we and our budgets adjust to all the changes that are coming our way.
Thank you very much, Cynthia. Our third speaker today will be Jennifer Harbison. Is that right? And she's with the Iowa Board of Regents.
Hi, good afternoon, everyone. I'm Jennifer Harbison. I am with the Iowa Board of Regents. I work on federal and state health policy for University of Iowa Healthcare in my role. And today I'm here to talk to you just about a couple of the programs that University of Iowa Healthcare and University of Iowa are able to receive in collaboration with our work with the Iowa Department of Health and Human Services. Specifically, the programs I want to highlight are related to our Child Health Specialty Clinics program. That's a statewide clinics program that works with children with special health care needs, and we have locations throughout the state of Iowa. In the document I submitted, it does have a link to all of those various locations. And so that is something that we receive via the federal Title V block grants, so specifically focused on maternal health care and child health care needs. That funding helps provide care to Iowa children. Again, Iowa has approximately 143,000 children with special health care needs. We also really appreciate the allocation to the statewide perinatal care program. Our SED Family Children Pediatrics Department and our Department of Obstetrics and Gynecology both receive some funding to help support the statewide perinatal program. And we do that in collaboration, again, with the Department of Health and Human Services and other providers throughout the state. Additionally, in Section 4 of the bill is the Preventative Health and Human Services Appropriations, and that is another area that we work in collaboration with the Department of Human Services on, and specifically our state hygienic lab and then the hospitals and clinics as well, work with the department to support the various goals within that program, including Healthy People 2030, Iowa's Health Improvement Plan, preventative health advisory committees, and risk reduction services.
Thank you, Jennifer.
Thank you.
Our fourth speaker today will be Flora A. Schmidt with the Iowa Behavioral Health Association.
Good afternoon, Flora Schmidt, the Executive Director of the Iowa Behavioral Health Association. IBHA represents the nonprofit licensed and accredited agencies who provide prevention and treatment services for mental health, substance use, as well as gambling disorders. This includes all the agencies who are currently part of the Integrated Provider Network receiving the federal substance use block grant funds, as well as 18 of the community mental health centers receiving the mental health federal block grant funds. Iowa Code requires these CMHCs to be accredited by the state to provide services within a specific catchment area of a county designated by the state to serve defined target populations with minimal or no service denials, regardless of that individual's ability to pay. There are 5 defined core services they must provide, as well as they're required to have a board of directors and to be annually audited. These CMHCs utilize federal block grants to provide 20 plus unique deliverables for adults, 25 plus deliverables for children, and multiple blended deliverables for adults and children, as well as specialized training for their own staff. As such, IBHA is asking that you amend Section 2.1 of the Community Mental Health Services Appropriations by including a new paragraph D that returns the legacy language for federal block grants to again direct 70% to be distributed to the state's accredited community mental health centers. That would be for the first fiscal year of the federal year 2025 through 26. We are also amicable to the amendment from the Senate 3116. These amendments would help to provide stability to the CMHCs to continue to provide these services, as well as to help maintain the staff necessary for continued access to the services. Thank you for your time and consideration, and my comments are printed out for you in the packet I provided.
Great. Thank you very much, Flora. I appreciate that. Does anybody on the committee have anything to add? Okay. Yeah. So in closing, thank you all for coming and giving us some information about the federal block grants. It is definitely our intention to make sure that monies are spent well in the right places. We continue programs that are successful, and as much as we can understand going forward how monies that come down from the federal government, however that may be, will come to Iowa in the best possible way. And we'll continue as a board, and not as a committee, I should say, and with the departments to find out those things and take those solutions to DC ourselves. Thank you for coming today, and that will be the end of this public hearing.